So we'll continue our discussion of the vitamins here with vitamin C. Vitamin C is a sorbic acid, and it is required for various activities in the body. Primarily, what we're concerned about and what we really see in patients who are deficient in vitamin C is the synthesis of collagen. So it's required for the effective synthesis of collagen. People who are deficient in vitamin C, they'll still produce collagen, but the collagen will be defective. It's also required for some hormonal processes, including the conversion of dopamine and tryptophan to norepinephrine and serotonin, respectively. It's also required for conversion of cholesterol to various steroid hormones, and then also for sufficient production of carnitine. Now, vitamin C is not required for the production of carnitine, but it's a cofactor and it helps you produce more carnitine. And so that's something to keep in mind. So I don't want you to get off of here thinking that vitamin C is required for the production of carnitine. That's been biochemically shown to not be true, but it helps you produce more than if you didn't have it. Vitamin C is also very well known as an antioxidant, and this is why it's associated with the immune system, and a deficiency of vitamin C will make you predisposed to infection. So if you go to the pharmacy, you'll see vitamin C supplements, and you'll say, oh, this boosts your immune system. And that's true to a certain extent, but it's true to the extent that people who are deficient in vitamin C are going to have some level of immunodeficiency. Vitamin C, being an acid, also makes the contents of the small intestine more acidic, and this will help enhance iron absorption. Foods that are rich in vitamin C include most notably citrus fruits, and then also other fruits and vegetables. Oh, and I might add here that they have to be fresh fruits and vegetables. If they're processed or boiled, the vitamin C is going to be inactivated. So vitamin C deficiency is otherwise known as scurvy, and this was a very, very, very big problem in the Middle Ages and in the 17th, 18th century, and only relatively recently, in the last 200 years, have we actually begun to sort of defeat this. Although we do see it occasionally from time to time, especially in children who are really picky eaters and their parents aren't aware that their kids really need to get vitamin C. So it was actually documented as early as the 4th century BC by Hippocrates. And it was very prevalent among sailors during the time of discovery in 15th, 16th centuries because of their diet that was based on primarily preserved foods. So these sailors would go out 3-4 months at a time without touching land, and so the diet that they had to have, the only food that they could bring was preserved foods, because otherwise, if it wasn't preserved, it would rot. But the problem with preserving is that you usually boil it, and when you boil things, boil foods, even foods that have vitamin C in it, you're gonna deactivate the vitamin C because it's heat label. So these sailors that had diets based on preserved foods would be deficient in vitamin C. And it was actually so severe that it killed an estimated 2 million sailors between the 15th and 18th centuries. During the 18th century, it actually killed more British soldiers than military action. So that's a really big deal when you think about it. There were several major wars in the 18th century, including the American Revolutionary War, that the British soldiers were involved in. And to think that scurvy actually killed more soldiers than actually died in military action and conflict is pretty remarkable. So here you see, I'm not sure if this is James Cook here, but administering a lemon to a sailor, trying to cure him of his scurvy. And this is where we get this concept of pirates having missing teeth and bloody gums and everything. So when you see these cartoons of pirates, that's why they're depicted that way. So James Cook in 1768 commandeered the first circumnavigation of the world without losing a single man to scurvy. And back in the 18th century and before that, it wasn't uncommon for sailors to go out with their men and lose half of their men, or even three-quarters of their men, to scurvy. So it was really, really dangerous for sailors to go out for several months at a time without touching land. And the fact that James Cook went out for 3 years and circumnavigated the world and didn't lose a single man to scurvy was really at that time considered a medical miracle. And the way he did this was actually to order his men to consume sauerkraut and citrus fruit regularly. And these products have tons of vitamin C in it. Sauerkraut is actually made by putting the sauerkraut in a jar, closing it up, or sauerkraut with water in a jar, closing it up, and the bacteria that naturally exists on the sauerkraut will actually ferment, and that's what creates the acidic environment, including the production of ascorbic acid. So as mentioned, scurvy is the deficiency of vitamin C, and it's manifested by poor development of collagen, and that poor development of collagen is going to give rise to symptoms in various systems. Primarily, we're thinking the skeletal system, which also includes the mouth and the teeth. So you'll see gingival bleeding. That's probably the most prominent sign. Some gum changes. It becomes more friable, fragile, becomes deeper red, even bluish or purplish in appearance, spongy in texture. You'll also see tooth loss, early tooth loss. Skeletal system, you see, you won't necessarily see it, but there can be subperiosteal hemorrhages. That can lead to pain, particularly of the weight-bearing bones, the femur, the tibia, fibula. So you'll see pain there, and then you can see what's known as a scorbutic rosary, and that's not really very different in appearance when you look from the outside from the rachitic rosary. And that's obviously what you see in rickets. Vascular, you can see petechiae, particularly petechiae that surround the hair follicles, and that's also another very characteristic sign of scurvy. Other things that you can see, and this isn't due to collagen, but you can see anemia due to the low iron absorption or relatively lower iron absorption, and also myalgia, and the myalgia is probably due to a deficient amount of carnitine. People who are at risk of vitamin C deficiency are people who consume unusual diets, particularly children who drink primarily pasteurized milk and don't really get a lot of diversity in their diet. Maybe they eat a lot of processed foods, processed breads, and they're maybe picky eaters. They don't like to eat their fruits or vegetables. They're at risk for vitamin C deficiency. We don't see it as much anymore. Vitamin C deficiency is rare because ascorbic acid is put in all sorts of different foods, and it's not necessarily put in foods because we want to fortify foods like how we use vitamin D. It's more of a public health thing. Vitamin C is used a lot for flavor enhancement and as a preservative. But we do see occasionally people with scurvy. It's not. This is not an eradicated disease by any means. When I was a fourth-year medical student, I actually saw a child who had the typical gingival bleeding and early tooth loss and gum changes that are very characteristic of scurvy. And sure enough, he did have scurvy, and it did go away with change the diet. Ironically, his parents were vegetarians, so you would think vegetarians are not going to get vitamin C deficiency, and they usually don't, but this kid did. So the manifestations of vitamin C deficiency relate to the symptoms, and this can include irritability, probably due to the pain, loss of appetite, frequent infections, leg tenderness due to the hemorrhages, which can include typically includes the knees and the ankles. The scorbutic rosary, and that scorbutic rosary develops from fracture of the provisional calcification of the ribs during respiration. And then, of course, you'll also see those gum changes and parafollicular petechiae. Those are probably the two more commonly seen symptoms of scurvy, and also possibly a microcytic anemia. The diagnosis is pretty much based on the history and the physical exam, and then also a radiograph of any affected bone is very useful as well, because you see these really specific characteristic changes. So it's always useful whenever you have a patient who has a possible vitamin deficiency or a malnutrition, to get your routine labs, because if a patient has one vitamin deficiency, they're at a much higher risk for another vitamin deficiency compared to other children. So we want to catch that as quickly as possible. So getting a CBC and smear is useful. And when you do that smear, if you see a microcytic anemia, you want to get iron studies. And certainly in classical scurvy, you would see a mild iron deficiency. A BMP with calcium magnesium levels are useful to make sure that all your electrolyte parameters are in order. A radiograph of the affected bone is going to be really helpful, although in some cases of scurvy you won't see as many of those characteristic changes of the bone as in other more severe cases. And then investigate for any other suspected nutritional deficiencies. So here's those gingival changes that you see in scurvy. So this is pretty severe. You can see that the gums are irritated, they're friable, and these teeth don't look very stable. There's a lot of bleeding around. And if you were to scratch the gums, you would get bleeding pretty easily, because these gums don't have the tissue is not stable, because there's a certain amount of collagen in all tissues, and if the collagen is not, remember, collagen really keeps our tissue together. And if the collagen is defective, then the tissue is going to be weaker. So you can see here, this is even more severe, especially in this area. There's a generalized gingivitis, but then there's also this really nasty area where it's turned almost like a blackish brown, purplish sort of color. So if you have a child with bone pain, then in the setting of scurvy, you definitely want to get a radiograph, because you can see some of these very characteristic changes, and these changes are going to be very specific and very useful in this setting. So some of these changes, you see a generalized osteopenia. So particularly where you're seeing the osteopenia, I got another picture that's a little bit more clear. But you see it down here, and then on the fibula, bottom of these two fibulas, the distal ends. Then you also see this little sign here, and this is called Wimberger's ring sign. This is wrong. This should be called Wimberger's ring sign. I found this online, but Wimberger's sign you would see in, that's something different. That's something you would see in congenital syphilis. But Wimberger's ring sign is a circular calcification that surrounds the epiphyseal center. And so you see it on both sides here. Another thing that you'll see is this denser line on the distal and proximal ends of the bones. And so you see it both in the tibia and the fibula, both in the proximal and distal ends. And these lines, these denser white lines, are called white lines of Frankel. Another thing that you'll see close to the white line of Frankel, either just distal or just proximal to it, is this more radiolucent zone. If you really zoomed in here, you kind of see it on this side. Note that just distal to the white line of Frankel here is this more radiolucent zone, and this is called Trummenfeld zone. Trummenfeld zone. It's a mouthful. Trummenfeld zone. Another thing you see is this sort of thinner but whitish, very dense white, these edges of the bone. You see it here too. And what this is a periosteal reaction, probably due to subperiosteal hemorrhages. And then finally, another thing that you see here, they call it a Pelkin's fracture, which it can also be manifested as a spur. in which case it would be called Pelkin's spur. These are metaphyseal spurs, and they can fracture off. So you can see it on either end of the bone. So here you see white lines of Franco here. You see your Wimberger's ring sign. You can kind of see the Trummenfeld zone. And then there's a Pelkin spur here. This might be a Pelkin spur. Maybe this here too. So it's kind of hard to tell. But this is clearly the radiographic signs of scurvy. So here's your parafollicular hemorrhages. And you may see these if they're really widespread. It might make you think of possibly Henoch-Schönlein purpura. But in the setting of gum changes, and definitely if you have those radiographic signs, this is certainly going to look like scurvy. This is going to make you think scurvy. But these are little small petechiae that are around the hair follicles, and that's important that they're around the hair follicles, because that's how they appear with scurvy. So I'm not exactly sure of the pathophysiology behind it, but there's probably X amount of collagen around these follicles, and so the tissue milieu around the follicles becomes weaker, and all that vasculature that feeds the hair is going to bleed into the tissue. So you see, where's a good one? Right here. This is a good one. You see the hair coming right out, and right around the follicle is the hemorrhage. There's another one right down there. So these ones look a little bigger. But again, you see them, the hairs are coming out of the petechiae. The differential for vitamin C deficiency include various, these are just a few things. Arthritis can be on the differential. You can get some bleeding around the joint spaces, and that pain, especially if it's bone pain near a joint, can make you think of some kind of juvenile arthritis. Osteomyelitis may come up as a possibility, and that's because you have bone pain, and so we always think of bone pain when we always think of osteomyelitis as a possibility when there's bone pain, because there is osteopenia. The child's going to be at risk for fractures, and these fractures can occur over a long period of time, and so you can get fractures of various stages of healing. And anytime you see that, the red flag for child abuse comes up. But you're going to be able to differentiate child abuse out, especially if you have those friable gums, and also if you see a microcytic anemia, and certainly those other bone changes. Henoch-Schönlein purpura can be something that you might think of, considering you have all those petechiae, but Henoch-Schönlein purpura is a little bit different. You won't see those bone changes. You probably won't see, you certainly won't see the gum changes. And then leukemia, this can come up on your differential because you can get an anemia with leukemia, just like you can get with vitamin C deficiency. You can also, those purpura, petechiae, may make you think of possibly a platelet deficiency, which you would have in leukemia. And then also with vitamin C deficiency, you can have a susceptibility to infection, and you can get that in leukemia as well. So those are some similarities. But again, if you look at the radiographs, look at the gum changes, which are very prominent in scurvy, that'll help you with your differential. Management for vitamin C deficiency is oral replacement with supplements. It's pretty easy to do. You'll want to replace the vitamin C really quickly. So just going on to a proper diet right away, or just going onto a proper diet right away alone, is probably not advisable. You'll want to have supplementation in addition to an oral or a proper diet. But definitely instructing the parent and starting a proper diet, which includes sources of vitamin C, fruits and vegetables, even if it just includes orange juice or fruit juice. It's pretty easy to get kids to to get kids to eat vitamin C or foods with vitamin C, because there's a lot of sweet fruit juices that have vitamin C, and a lot of kids like that stuff anyway. And so educating the parent on foods that are high in vitamin C, trying to work something into the kid's diet that has enough vitamin C so that you can get these symptoms to go away. And then referral to an orthopedic surgeon or a dentist based on the symptoms. If there's severe tooth loss or bone changes, you might want to get a specialist's opinion on what to do about those things. As far as vitamin C overload, vitamin C being a water-soluble vitamin, it's very, very, very difficult to get to get too much vitamin C. But it has been associated with constipation and some symptoms. But you really, in order to get a vitamin C overload or any symptoms, which there's not a lot, and it's really not dangerous at all, you really have to be like consuming those vitamin C tablets. And you might see that in some people who think that if they just totally overload themselves on those vitamin C tablets, that they might be able to keep themselves from getting a cold in the winter. But for the most part, just like the B vitamins, it's very difficult to get any kind of overdose on vitamin C.